figures released by NHS Digital show that in 2017 14% of women were still smoking when they gave birth to their baby. There were 2,469 women in the area recorded in 2017 as smokers at the time of giving birth, out of 17,134 total maternities recorded during the same period. Knowsley saw the highest proportion locally with 18%, or 364 new mothers known to be smokers out of 2,041 maternities. In Halton, 228 women out of 1,386 were smokers when they delivered 16%. In South Sefton and St. Helens, 246 women out of 1,598 maternities and 308 women out of 2,051 maternities were smokers when they delivered respectively 15% in both cases. According to experts, women in areas with high rates of smoking tend to have high rates of smoking through their pregnancy. In our area, the rate of women smoking at the time of giving birth has been above the national average for at least the last 5 years. Across England, there were 64,446 women known to be smokers at the time of giving birth in 2017 to 11% of the total 603,948 maternities recorded in the same period. Earlier this year we reported on how a mum-to-be felt as though she'd been forced to walk through a curtain of smoke as she turned up to antenatal classes. Rachel Adedeji, of Hollyoaks and X Factor fame, became so disgruntled with the amount of smokers outside the women's hospital, she took to sharing pictures of the perpetrators online. Rachel, 26, told The Echo she was forced to take the drastic measure of shaming the smokers on social media because she felt there wasn't enough was being done about the issue. A woman 8 months into her pregnancy, Image, PA, she said, "I don't judge anyone who smokes. I've got loads of relatives who smoke, but there's a time and a place. We are outside a hospital solely for pregnant women and their babies. We are not outside a club. This isn't me being a ranty non-smoker. I've spoken to a lot of people who feel the same way, and the other day I witnessed a man having to waft smoke away from a car seat which he'd brought to pick up his newborn. He shouldn't have to worry about that on such a happy day for him. They are right at the entrance of the hospital. It is a 2 or 3 minute walk from the entrance to the car park to the hospital doors, but instead they smoke right outside the entrance even though there are about 7 signs warning them not to, and pregnant women, and women with babies, are forced to walk through it just to get to their appointments." Mum-to-be shames smokers outside women's hospital. Rachel even claimed she has seen heavily pregnant women in their pajamas also smoking on hospital grounds. Commenting the figures, Action on Smoking and Health, ASH, a charity that works to eliminate the harm caused by tobacco, said, "If a woman smokes or is exposed to secondhand smoke in pregnancy, it restricts oxygen to the baby and prevents it developing properly. This means babies might be born with health problems and can lead to miscarriage, stillbirth and cot death. Areas with high rates of smoking tend to have high rates of smoking in pregnancy. In places where smoking is common, more women are likely to be smokers when they find out they're pregnant. Many will quit, but women who are highly addicted, live with other smokers, or lack support to quit are less likely to be successful. It is so important that services are in place to support women to quit before, during and after pregnancy." CCAG, number of maternities, women known to be smokers at time of delivery, percentage NHS Knowsley, 2041, 364, 18% NHS Halton, 1386. 228, 16% NHS South Sefton, 1598, 246, 15% NHS St. Helens, 2051, 308, 15% NHS Liverpool, 5886, 820, 14% NHS Wirral, 3175, 404, 13% NHS Southport and Formby, 997, 99, 10%.